Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We have new breaking news for you. Breaking updates. So, before we get into that, let's get today's topic. We have some other information too. But today's topic is breaking news about 2 DSOs you'll only hear on this YouTube channel. We're going to give you an update of what just happened about a couple of DSOs. So, before we do that, as you know, we now have 10 employees. We're in over 20 states now. And we're selling dental practices nationwide. We're available to you from 8 a.m. till 9 p.m. every day except Christmas and Easter. So definitely give us a call. Our phone number is 201-663-0935. And our website is dentalpracticeguide.com. Or you could also reach us at nationwidedentalpracticebrokers.com. But anyway, we enjoy what we do, and we hope to share that enjoyment with you and the knowledge. That's what we do. In fact, I have fun every day. I just stopped and got a great, with this place called Pretzel Factory. There you go. Check that out. Woo! Many of you sellers are thinking about sometimes what other alternate businesses can they get into. I don't know. There's something about a hot pretzel bakery factory. They started in Philly, they moved up to Jersey, New York. I don't know if they're nationwide yet. Great little business on the side because the food is, it's a perishable food, but it's frozen. So you don't have to worry about it like a restaurant, which is 85% of them eventually have some kind of problems. They go out of business. Not a bad sideline, you may want to check it out. I don't know if you go by franchises or whatever, but often doctors ask me, what am I going to do after I retire? But you can pick up something like this. Always seems to be busy. People are always there. There's something about hot pretzels. But there's also the many other fields you can get into. Once you retire, you'll never be bored. So anyway, the information we're about to share with you is for entertainment purposes. It's not legal or business advice. Also, if you're thinking about selling to a DSO, please call us because we deal with them all the time. And they will often pay our commission. We have inside information that you're not going to get. You'll hear some of it today. But when you deal with the DSOs, and we have inside information about them that you won't hear, we try to pick and choose. Often they will pay our commission, so the seller doesn't have a commission when it's a DSO sale. But we know what's going on with them, and we could share that with you. We get the same commission from all the DSOs. We don't care. And we're not employed by them. We're completely independent. But we want the best for you. So we'll help you pick and choose, and they'll pay our commission. Often when you work with us too, based on criteria, we will get your legal fees reimbursed upon successful closing. So call us and we'll get that taken care of for you. Okay? That's important. Please remember that. We've done that multiple times. When it comes to DSO sales, for the seller, we'll reimburse their fees. Anyway, so what's going on? One DSO right now, and you're not going to read about this, hear about this. It won't be in print. They won't have it in their advertising. They just closed down a relatively large office, about a $700,000 office. They shut it down. And they say we're consolidating. Yeah, but they paid a fair amount of money for it. And yes, they're going to try to move the patients 20 minutes away. But in a suburban area, you move somebody 20 minutes away, they just may not want to follow you. Why did it happen? I think one of the reasons is they engaged the doctor to stay on. He stayed for his time period of 3 years, and they put associates in there. But the associates started changing around, so every time the patient would go in, there'd be a new associate. So that is a problem. So they shut the office down. That's it. Empty. The lease ran out, shut it down. Now they're trying to move some of the patients over to this another office, but 20 minutes away. You don't hear about these things. We do, and we share it with you. Okay? That's the first one. Now, the second one. The DSO was not pleased with one of their offers. They were having trouble with one of the doctors, and this can happen with anybody, but this is a great DSO, and I continue to sell to them. But they cut their losses, and you would be shocked how much they sold it for, how little they sold it for. Through negotiations, they wanted to get out. They just wanted to finish it. They wanted to be done with it. It was a kind of a problem often. They weren't making the profit they wanted, and they sold it about 90% off. 90% off. So in other words, 10% of gross. That's like a huge discount. They've never sold a practice like that. Although there have been practices that certain doctors have walked away from and so forth. But I've never sold a practice for 90% less than the gross. In other words, 10% of the gross is what the practice sold for. That's not a lot of money at all. And why they sell it for so little? They cut their losses. Now, this is a great DSO. I'm an advocate of theirs. I do like working with them. I think they're a great DSO. But you're not going to read about this. It's not going to be advertised anywhere. It's not going to be in their promotional materials. You simply will be out of touch on this one. You'll know nothing about it. It'll never be advertised. It'll never be communicated. It will never be discussed. It is just, it's nowhere. The information is nowhere. So we know something about this DSO now that other people don't know. Maybe a word of caution, maybe we're a little careful, more careful now. But this was a situation where the office was shut down, cut their losses and shut it down. So these things do happen. We hear about these things. And when we hear about them, we'll share it with you. And that's what we're doing now. We're not going to say who they are. It doesn't matter. We can talk about it privately, but we're not going to, talk about it. Keep it under wraps. But it's something to be aware of, that these things will happen, and you have to be kept abreast of them. We know about these things before anybody knows about them sometimes, because we're in there. We're like the cop on the beat, we're the policeman, we're the news reporter at the front lines. We hear about it often. We know about things that nobody else knows about. So we're excited to share that with you. And let's keep talking. Please keep listening. Listen. So hit the subscribe button if you want more information. We're about to do new videos. I think we're at, what are we at? I think we're over 400 YouTube videos now. And also, if you are going to, we still have our cruise going on. We have about, I think, 4 or 5 people. I think 2 from Australia, 3 from the United States. We're leaving on January 12th from Australia. We put out a flyer on that. Call us if you have any questions about it. There's still room, and there's still room on the ship. We're doing our continuing education seminar all about buying and selling a dental office. It's going to be easy. It's going to be great. It's going to be intimate. I love cruising, and the weather's warm, and there's a tax write-off. So give us a call. We can give you more information on it. Thank you. Bye.